switch gears. We're going to do a case consult. We've been breaking down the overachievers, the overproductive, but underfeelers, and today we're going to look at a case of underfunctioning. The people that are stuck in the freeze and have difficulty motivating. A case of a patient thriving and overachieving to going to underachieving and doing the bare minimum. Our case study is an adolescent male in his late teens. A parent that's used love and logic parenting style and has been effective for the majority of this patient's life. The patient was an independent child, needed little to no prompts to complete daily chores, schoolwork, daily tasks. A kid that went with the flow, has a high IQ, good grades, funny, easygoing, and a very likable guy. Comes from a two-parent household with an active social life, no substance abuse history, and a mental health diagnosis. This kid sounds super easy until he wasn't. A switch flipped, the motivation dropped, his work decreased at school, agitation increased, defiance increased, and the parents were at a loss. Should they continue the love and logic parenting style? Is it depression? And do the parents need to switch gears and be more active or allow natural consequences to unravel the last 13 years of his school's high GPA to a plummeting GPA when the stakes are high with college admittances and scholarships at stake? How do they best support this kid, and what is best for him? How do we support the parents through this process, because it's very painful?
Welcome to Fit Mind Chats. Get comfortable, join us in our virtual therapy office, and get ready to gain insight into motivation that drives behaviors you don't understand. I'm Sarah Dellavella, a licensed independent social worker.
And I'm Abby Smeedy, an independently licensed clinical counselor.
We're the owners of Fit Mind Cleveland, a mental health private practice in Cleveland, Ohio, with grounded therapists that are approachable and meet where you're at in life, a place where you see your strength and grow your greatness.
When we were deciding on a title for this podcast, there were some titles that came to mind, and these apply to the scenario above, but also can apply to adulting of all ages, I think.
Yes, we can't forget, even though we are talking about a 17-year-old here, about to be 18, this actually applies to adults. Adults can underfunction. So,
absolutely.
Here we are, straight A's on autopilot, then he turned it off.
How maddening is that? Or actually from the parent from last week that had the concerns with the child that thought they were a dummy. Yes. Imagine this child overachieving and then slamming on the brakes and being like, I'm done.
I'm not doing it anymore.
I'm over it. There's no purpose.
And parents don't know why. They're like, what the heck?
Stakes are high right now.
Yes, they are.
And they just stop doing it. What is that about? And a lot of times that's when kids start coming to therapy because they have the attitude like he could, he just didn't.
He could, he just didn't. Yeah,
decided not to.
Which is tough because we talked a lot about stakes are lower when they're younger, and then stakes get higher as they go on, as they get older. We're talking college, we're talking scholarships.
Right.
So this particular parent's like, I'm watching him stall
out in life, kind of give up at the 25.5 part of a marathon.
Yes.
You just got to get 26.2 if you're not familiar with marathons, and they're at mile 25, and they're like, I quit.
I just don't want to.
I'm not going to finish. It can be maddening for a parent. Absolute maddening. It happens in the office all the time. And these kids are great kids. They're lovely. They're likable.
Yep.
They just stall out.
Yeah. Effort optional, a case study.
That's us right here. This is this case study right now that we're going to go over. A case study, the effortless A student who chose underachievement.
Ooh, yep. I also like this one, a case of an intentional underperformance.
And I think this is more prevalent than we give it credit. I feel like there is a lot of intentional underperformance. Kids, how we've talked about resentment and holding things in. One of the most passive aggressive things you can do
as a kid,
where does your power come from? I can be intentionally underachieving.
Yep. My mom and dad want me to do well. I don't. Well, guess what I'm going to do? I'm not going to do well.
What's easier? Not doing well.
Yes.
It's easy.
You want to get under mom's, under her skin, or dad's, whatever it is. Stop turning stuff in.
Oh. And you're like, and the parent is like, that is an easy 10 points.
Thing you could do.
All you have to do is do 10 points. Now you got to get an A on the test to continue this A or B or whatever it is you're trying to get.
Yep.
Most kids know that, and a real passive aggressive behavior is to be like, I'm just not going to turn it in.
Yep.
They might not even know that's not the reason they're not turning it in.
That's the other. That's sometimes this stuff is pretty unconscious for a little while before we can make it more conscious for the person, whether they're a child or adolescent or they're an adult.
And that happens in therapy.
It does.
That's when you're like, I think maybe you subconsciously didn't do that because you're making your parents upset. And you know this is the way to control.
It's like an FU.
Like
FU parents. That could be the cause here. We don't know. We're going to figure it out.
We're going to talk about that. And that's kind of like the case of the kid who figured school out and then checked out. And a lot of kids kids figure out the system. And
yeah, and sometimes they just kind of go, I'm bored. Could be boredom. We don't know.
Right.
Born smart, retired early. I like that.
That was a good one. That's a good one. I agree. Like, because I do feel like senioritis starting in August. Yeah. It's a bad sign, guys. Yes. It's a bad sign.
Senioritis is a real thing too.
It is. I mean, I get it. 13 years.
How many parents are like, I am trying to help my child apply for colleges? I have heard so many parents be like, I think I might lose my mind.
I will say, I have a senior.
Yeah.
I will say senior year has been the most challenging year ever. Applying to colleges, looking at scholarships. Every month, there's a deadline.
Oh, God.
And if your kid's not invested in hitting that deadline, the parent is in a pain. I know, like, for me, then I'm like, this is more important to me than you. It can't be that way.
But at the same time, this is where the stakes are high. Like, so you're like, remember, you got a deadline. It's coming up here. You getting it done?
Or you don't go to that school.
Yeah, or you're not going.
You're not going to that school. Maybe that's the school you wanted to go to. But if you truly wanted to go, wouldn't you have turned it in?
Good question.
Yeah, we don't know.
High GPA, low interest, mild hostility.
That fits.
I
wouldn't say a lot of kids that come out to their families. They come in the office. They're very pleasant.
Yes.
Very smart. Yep. Admit I have zero interest in continuing like my high school career. Yeah. Like, I'm bored. It's dumb. I'm done. I get that. 13 years.
Yeah, it's a long time.
It's a long time.
Yeah.
And you're also to the point too where this is so healthy. You're cutting that apron string going into adulthood. So you want that independence. High school gives you a lot of it, but it's still kind of boxing you in.
And they're at that developmental phase where they are ready to go. I don't know who it was that said this, but they said ultimately that the teenage years, they're pushing you away, so you're ready to let them go.
Best statement ever.
Right?
I mean, you know you've done it right.
Yes, when they're doing that.
Yeah, and I mean, maybe that's a statement as a parent that's listening that you might need to hear. You've done a great job if the kid is ready to go.
Yes, absolutely. And they are telling you, I can't stand being here anymore.
I want to leave.
Which is hurtful to the parent, but it isn't indicative of like bad parenting. It's just the phase of life your kid's in. And that's always important to take into consideration is the stage of life they're in.
I agree.
So we are talking about underachieving or underfunctioning today, and what could possibly be the cause. So I'm going to ask you, Abby, when someone comes into your office stating, okay, let's say my child's motivation seems to be gone, or God, he's so angry all of a sudden, so easily agitated. Tell me what you're thinking.
As a therapist, if you're a parent bringing this issue into my office, because I feel like how we do it is I meet with the parent first, the session, child second session, because I want to get both sides of the story without any muddying of the waters.
Yes.
So I take the child's academic history, I take their family history. Is there anxiety, depression, ADHD in the family history? Has there ever been a diagnosis? Has there been any psychiatric treatment, hospitalizations, brain trauma?
Yes.
Social history is huge. What does their social life look like? Sleep, diet, and exercise. What does that all look like? What are their relationships like with their parents, their family members, their friends? Because it's all encompassing. You can't make a diagnosis off just like they're irritable, agitated.
Angry.
Yeah, he's angry. Because there could be so many reasons for that. So we kind of dig in, and the questions I ask the parents, when the child is old enough, they're the same exact questions. I answer them. And I think everyone's very surprised at how different the answers are between what the parent thinks is wrong and what's actually going on with the kid.
Yeah. So you are information gathering at this point.
Oh, absolutely.
You want to know, what do the parents see?
Yep.
What is this kid seeing? How does he see this problem?
Right. Is it a problem for him? Because it may not be. They might be like, it's not, I don't care about college.
Yep.
I'm going to go. I don't care. It's more important to my parents than it is to me. That is a common answer.
And you made this point, actually, probably when we were just talking about this. And I couldn't believe it. I couldn't agree more with it. Is that a lot of times people come in with a problem that they think is the problem, but it actually isn't.
Nope.
So part of our information gathering during sessions, because we're always doing that, not just the first session, is we're trying to figure out Look, our job is to figure out what is the problem? Like what's actually driving the problem? Right. That's what we want to figure out.
And sometimes they don't use words to describe that, but when they tell you scenarios and situations that happen, a light bulb will go off and you're like, oh, that's really interesting. That happens in this circumstance, but it doesn't happen in all your circumstances. So, wow, you can control it.
That's important. So you're also looking for, where does this problem show up?
Right.
How about school? How about home?
Right.
How about in his activities? How about in his, if he's working, if he's a teen, is he working?
Right.
And then social, like friendships, like how does that show up? So you're looking for, like, where is this showing up?
Absolutely. And a lot of times, like I hear this all the time in my office, is, oh, it's only with us. His teachers tell us, or her teachers tell us that she's, she's active in class, she's a helper, what a great kid you have. And you're sitting there thinking, like, they're a complete turd at home. Like, I don't see this side of my child at all. And I think that's very common. And that is a great sign, because that tells you that your child can read a room.
Yes.
And if your child is not reading the room and these behaviors are going across the boards, then we're looking at other issues.
We are. Because here's what we're really trying to assess for. What's going on? Because this very same symptom, like I can't concentrate, or I have no motivation, or I cannot seem to get going on tasks, can be due to ADHD, anxiety, depression, and that's just to name 3. The reality is that what our job is to do is to figure out if, we need the full picture and the context, and we use a lot of that context to help give us clues as to, is this more depression? And so, Abby, if what might you hear if it's depression related?
It's really hard, because in depression in male teens, you'll see increased in agitation. Yeah. But what I look for is, are they getting up? Are they showering? Are they doing stuff with their friends? Are they participating in their activities? Are they isolating? Are they withdrawing? Yep. I look at those pretty intensely, because a lot of times kids in the teen years, early 20s up till 25, the hormonal things are happening in their body. There could be an increase in agitation and irritability and annoyance. But let's look at, how does this affect them across their entire lifespan? Are they going to school? Are they going out with friends? What's their diet look like? A teen diet can look real crappy. Once they can drive and get their own food, they might make some bad choices. Are they eating? Are they overeating? Undereating?
How about sleep for a teenager?
Sleeping is the biggest battle. In my office, hands down.
Sleep is, so for teenagers, it looks different.
It does, because their melatonin drops. Like, this is, not to go off topic here, but I really think school should start later, because the teen brain, from once puberty hits, is really not ready to learn until 9 a.m. or 10 a.m. Because their melatonin stops or drops so much later. So that when you see your teen all of a sudden staying up to 11 or 12, that's because their melatonin is dropping later. And that's right around puberty. So therefore, they want to sleep in later. And then we start seeing the cycle of being overly tired, which increases agitation, irritability,
and even some depression.
So we inspect that. We definitely investigate that, because you're like, oh, this could be a sleep issue. One of the hardest battles I ever have in my office is like, how could I get you to get 8 to 10 hours of sleep?
That is.
What could we do? No napping.
1,000%.
No napping.
Yes.
I want no naps. I don't like naps. You're not getting your full REM sleep. But like, it's a battle. And sometimes I'm like, I'll take 7. I'll take 7 hours.
There's a negotiation there.
Yeah. And it's hard. That's a hard one. That's one of the most difficult.
I was going to say, for adults, it's actually very similar. Like, I think people don't think of anger as a symptom of depression. I think people think of people laying in bed, not able to get out, not showering, like crying, tearful. We have like a loss of interest in activities they used to enjoy, or they can subjectively feel like, I just feel depressed. I feel like, or I feel nothing. I feel numb. Sometimes I have adults talk to me about like, I'm numb. I don't feel a thing. That's where, I can go 2 different ways with that too, because numbing can be a result of trauma. You could be dissociating. So again, like, the one phrase doesn't always mean, oh, they're depressed.
And people come in self-diagnosed. They'll look up on WebMD and they're like, I'm depressed. Or like, they'll give you this very bizarre diagnosis where you're like, less than 0.005% of the country has that diagnosis. It's probably not what you're experiencing. But let's explore why you think that. And I think with teens too, teens definitely look up stuff. So a lot of kids look up like, I have lack of interest. I loss of joy. And when their textbook telling you this, you're like, in your words, tell me how you're lacking joy and what you're doing. Because like it could be like they come in angry at their parents a lot. Like I'm not doing anything, so I'm grounded. Well, that's different than you not being able to motivate yourself to get up out of bed, shower, and go to like the party or whatever it might be.
Yeah. I think like a hopelessness about the world, like when you start steering, or when you hear people say things like, what's the point? I'm not really sure what the point of all this is.
And I think it's interesting because teens right now are in a very difficult, precarious position because I'm not getting into politics, but our politics have been very much so. Yep. And like they're experiencing that. They don't know what's going on, but they're scared. It's very scary. Like when you look at what's going on
in the world.
Yeah. And
they lived through COVID too.
COVID. I mean, then we have these kids are like, you're looking at your teens they were second, third, fourth, fifth, sixth grade. Those are huge developmental years.
Yes. And
we experienced a major pandemic. I mean, so I think when you're looking at this, like, what's the point? Well, yeah. What if there's another pandemic? What if our world implodes? I don't know what's going to happen in this world. Why would I go to college? I don't know what's going to happen. And so I think that's like, it's a major
therapy
factor.
Gives you a space to talk through some of those things.
And validate those things. Hell yeah, it's scary right now. I'm with you.
And how did COVID affect you? I want to know, what was it like for you? And I want to know how did it change you? Same for what's going on politically. I want to know, what are you seeing? How is it affecting you? And how is it changing things? Like it changes your sense of safety in this world. So,
and not knowing what's going to happen. Never in a million years, if you told me there would be a pandemic and the world was shut down, I'd be like, oh, science fiction. Probably not.
Oh, yeah.
Yeah, and like, it's their reality.
Somehow lived through it.
And talking through that, because is that depression or is that fear really valid?
Yes.
Fear.
Yes. I also like to think of it because anxiety is another one. So like we have, I call it not just me, but underfunctioning. So there are underachievers. So for anxiety, some people overfunction to fix their feelings of anxiety. So we've talked about those people. Yeah. They're the productive and not feeling. They're they are overscheduled, right? It is truly an aim to fix their anxiety. If I do more, then I'll feel more in control of my world. The underachievers are the opposite. When they are overwhelmed and their anxiety gets really high, they go into a state of avoidance. So they're scrolling, they're binge watching Netflix. Dude, I can relate to that very much so. So we underfunction with anxiety. The higher your anxiety goes, avoidance works. In a short-term way, it works. And then in the long term, your anxiety builds higher and higher. You are now in this cycle of anxiety and avoidance. So like,
that can also look like depression, which you're avoiding, you're not doing.
And you're like laying down. You're withdrawing.
You're paralyzed.
So the very same symptom could be coming from a different place. Absolutely. And that's what a therapist is trying to suss out.
They weed that out.
They are trying to weed it out. Even ADHD.
ADHD, anxiety, and depression are so closely entwined.
They are.
Figuring out what it is and what it isn't. I mean, that can take several sessions. That's why therapy is not like this quick fix. It's usually like, hey, and it could be like, hey, I thought this was ADHD.
Exactly.
This is anxiety.
And also comorbid, right? So sometimes with adults, I see their anxiety first, and then we go, and then all of a sudden we're talking more. And through more of this history, I'm starting to learn, I've always struggled in school. I've always had a hard time like following through on multiple tasks that have like multiple steps. I always miss at least one. And all of a sudden I'm starting to go, wait a minute. Okay, this is sounding a little bit more like ADHD because they do co-occur. Much like anxiety and depression, they co-occur. The other, there was something else. We were going to talk about severity.
Severity, yeah, and looking at the severity. And like, I think this is important too, because a lot of times we're like, if a high achieving kid, say you got a kid that's got a 4 or 5, and they drop to a 3-5, that's a significant drop. But other people might be like, 3-5, that's still really good. But we look at the individual. It's a big drop for an individual. A kid that goes from a 2.8 to a 1.8, that's significant drop. So we look at like, hey, what's going on? Like that's not turning in a lot of stuff.
No.
That's maybe not studying for any test.
Yes.
What's happening here? So I think we got to look at where the kid is, and it has to be relevant and individualized for everyone. Because what's high functioning for one person is low functioning for another.
Yes. So each individual person that walks into your office, my office, I am looking at from through a lens of them.
Yeah.
What did they used to do? What are they doing now? What do they think their limitations are? What do I maybe see as what their strengths and what they're struggling with? Because I might see it differently also.
Oh, yes.
And we navigate that.
I check in with people. I'm like, this is what I'm seeing.
Yes.
Does it fit? And I'm always like, please tell me.
Yep.
Please tell me if it's not a fit. Because if it's not a fit, I'll change directions. Let's not waste your time. Let's not waste my time. We can change directions. Another area, this is quick hit, because this is going to be a whole other podcast.
Yes.
We assess for burnout.
Oh, yeah.
With the underachieving,
yes.
were they ever a high achiever, overachieving, and then all of a sudden underachieving? Because it's treated very differently than anxiety, depression, ADHD. Burnout is treated completely differently. So you've got to weed these things out. It's not a one size fits all. So whether it be a male teen, which I feel is very hard and difficult right now because, they're not allowed to have feelings sometimes. And I do think therapy is becoming more of a thing for this age group and more of a norm. Yeah. So I think that's a great way to go, which leads us to another thing too. So if you have a kid or an adult in your life that is underachieving, underfunctioning, and you think, hey, counseling might work, you want to ask them, are you open to going to therapy? And if they are, fantastic. If they're not, maybe back away from it. Because if they're not ready, they're going to come in the office and do zero. And they're going to hate therapy. They're going to think it's a forced situation. It's going to end up being counterproductive. You got to wait till they're ready. And I usually check in when I have kids that come in and they're like, no, I don't want to do this. I'm like, okay, I tell the parent, you know what? It's not the time. Check in with them in 3 to 4 months. And you just ask them, are you willing to go? And if they say no, you back away. Okay. You can't force.
No, we do not recommend forcing it all. We also think the fit with the therapist is really important. Okay. So when you're looking at, this is, in this case, a teenage boy, but your own child, you might want to say, who would you be more comfortable with? Is it a male? Is it a female? What kind of people do they tend to work really well with? Right. You want to look at who, if they want someone who's really quiet and nurturing because that's what they respond really well to, great. If they like more directive, someone who's more direct, maybe a bit more like gently confrontational, that might work better for them.
Humor confrontational.
Big
with kids. But also, too, if there's a teacher that they have like bonded with or attached to, what is their personality style? Are they, sweet and soft, or are they the funny teacher that's direct? I mean, it's hard to get a good grade in that class. That kind of tells you the person that they're responding to.
Yes.
And you can look up, like, there's Psychology Today. You could ask for referrals from Fringe or pediatrician.
Yep.
You can do all those things to find a therapist, but the fit is important. And I always say this in my office, too. If I'm not a fit, I'm okay with that. What's important is that you find someone that speaks your language.
I could not agree more. This is not, hope matters, and so does the relationship to your therapist. Those are two of the best predictors of success in therapy, is that they have hope. So we are working hard to give them hope. It's where you give them a lot of education on what's going on for them, and what sort of treatment methodologies you use.
Right.
So, like, you aren't going to direct the treatment. And certainly you and I are not going to direct this treatment. Like, a therapist is going to come up with a treatment plan.
Absolutely.
Based on that really thorough history that we just talked about, that they're taking, and from all of the attention they are currently giving to what's happening in front of them and what are the context clues.
Absolutely. And I think one of the best pieces of information I ever got from a professor in grad school was like, walk in the dark with a client, let them lead the way.
Yeah.
Let them lead the way. And like with teens, adults, therapy isn't like this quick hit.
It is not.
And sometimes people come in and they think it is, and then they back out because they're like, I'm not coming back. But they'll return when they're ready. And that's, I think, such a big piece. And with adolescents especially, like, I just kind of get out of their way and walk with them and validate like what they're going through. Because I mean, what may be a big deal to them is not a big deal to you or me, but if it's big to them, it's valid.
Yep.
And kind of letting that happen.
I hope you've enjoyed our chat today.
Absolutely. This is like how we case consult.
Yeah. Thanks for tuning in to today's episode of Fit Mind Chats. We'll see you next Monday for another session.
If you have a question or topic covered, or a topic you would like us to cover, follow us on Facebook, FitMind Cleveland, and message us. Or you can also message us on Substack. If you'd like to seek out therapy services, go to our website, fitmindcleveland.com, and contact us.
If you'd please leave us a rating, a review, and share our podcast with family, friends, enemies, really anyone that needs it. We really want to bring mental health access to all the people that can benefit.